መጣሁት adrenergic ድራጎችን ይዤላችሁ የመጣሁት the previous class will say about adrenergic receptor so በባለፈው ቪዲዮ ላይ adrenergic receptorዎችን ይዤላችሁ መጥቻለሁ ዛሬ ደግሞ adrenergic ድራጎችን ይዤ መጥቻለሁ so adrenergic drug are very important they treating a different medical disorder so የተለያዩ medical disorderዎችን ትሪት የሚያደርጉልን የፋርማኮሎጂካል ፓርቶች ናቸው so ቀጥታ የምንሄደው classification of adrenergic drug so adrenergic drug can be classified into three the first one is direct acting of adrenergic drug የምንላቸው አሉ ሁለተኛ indirect acting of adrenergic drug የምንላቸው አሉ ሶስተኛ a mixing agent of adrenergic drug የምንላቸው አሉ so the first one is a direct acting of adrenergic drug so adrenergic drug direct acting of adrenergic drug can be classified into two selective direct acting of adrenergic drug and non-selective direct acting of adrenergic drug so selective because adrenergic have two receptor alpha receptor as well as beta receptor when you say selective adrenergic drug the drug they selective either alpha 1 receptor or alpha 2 receptor either beta 1 receptor or beta 2 receptor so selective adrenergic receptor the first one is alpha 1 receptor the drug they select only alpha 1 the drug is phenylephrine as well as methoxamine so phenylephrine as well as methoxamine is alpha 1 selective adrenergic drug the drug are the only select alpha 1 the second one is alpha 2 selective alpha 2 selective is clonidine is a drug they select only alpha 2 receptor so the second one is beta receptor the first one is beta 1 receptor selective beta 1 the drug only selective in the beta 1 is dobutamine so dobutamine are the only drug they selecting beta 1 the beta 1 is found on the heart so dobutamine is selective beta 1 the second one is beta 2 selective በጣም ብዙ ድራጎች አሉበት so beta 2 ብቻ select የሚያደርጉ beta 2 የት ይገኛል inside the nose inside the mouth the bronchial smooth muscle and the uterus the urinary bladder ላይ ይገኛል ብለን አይተናል so this beta 2 selective drug is salbutamol salmeterol formoterol terbutaline albuterol sulfidrin እና bambotrol የምንላቸው ድራጎች is a drug they select only beta 2 the second one is direct acting ላይ selective and non selective ብያለሁ selective ላይ alpha 1 እና alpha 2 beta 1 እና beta alpha 1 ብቻ የሚያደርጉ አሉ select የሚያደርጉ alpha 2 ብቻ select የሚያደርጉ beta 1 ብቻ select የሚያደርጉ beta 2 ብቻ select የሚያደርጉ the second one is non selective the drug they bind with all kind of adrenergic receptor so adrenergic receptor alpha 1 alpha 2 beta 1 and beta 2 ብለናል so the first one is the drug they selecting alpha 1 alpha 2 beta 1 and beta 2 alpha 1 ንም alpha 2 ንም beta 1 ንም beta 2 ንም stimulate አድርጎ ስራ የሚሰራ adrenergic drug non selective is adrenaline so adrenaline is non selective adrenergic drug they selecting alpha 1 alpha 2 beta 1 beta 2 ሁሉንም select አድርጎ ስራ የሚሰራ ሁለተኛው alpha 1 ን beta 1 እና beta 2 ብቻ ደግሞ stimulate የሚያደርግ ኖር አድሬናሊን እንለዋለን ሶስተኛው alpha 1 እና alpha 2 ብቻ stimulate የሚያደርግ non selective drug xylometazoline tetrahydrazoline እና ኦክሲሜታዞሊን ብለን እንጠራዋቸዋለን እነዚህ ድራጎች ዳይሬክት አክቲንግ adrenergic drug so direct acting adrenergic drug can be classified into two selective and non selective alpha selective beta non selective ስንል both binding alpha 1 alpha 2 beta 1 and beta 2 the second one is indirect acting of adrenergic drug so indirect acting of adrenergic drug can be classified into three so the first one is noradrenaline releasing agonist የምንላቸው የኖራድሬናሊን ምርት የሚጨምሩ መድኃኒቶች አንደኛው አምፌታሚን ሁለተኛው ታይራሚን አምፌታሚን as well as tyramine are a drug of indirectly the increasing the production of noradrenaline from the preganglionic nerve cell. The second one is noradrenaline reuptake inhibitor. These are a drug that are important for the inhibit enzyme that degrade ኖርአድሬናሊን ኖርአድሬናሊን የሚባለውን መድኃኒት ዲግሬድ የሚያደርጉትን ኢንዛይሞች ኢንሂቢት የሚያደርጉ መድኃኒቶች the first one cocaine, the second one is TCA tricycline antidepressant drugs. The third one is MAO and COMT inhibitor, monoamine oxidase and COMT የሚባሉትን ኢንዛይሞችን ኢንሂቢት የሚያደርጉ the drug is selengine, parengilin, አይሶካርቦክሲሌስ ኢቶኮፒን እና ቶኮምፔን የምንላቸው ድራጎች ማኦ ኤንድ ኮምት ኢንሂቢተር እንላቸዋል። the third one is a mixing acting. The third classification of adrenergic drug is mixing acting. That means they working all kind of direct acting, indirect acting. የዳይሬክት አክቲንግንም የኢንዳይሬክት አክቲንግንም አክቲቪቲ ደርቦ የሚሰራው የአድሬነርጂክ ድራግ መድኃኒት ኢፌድሪን ይባላል። These are so what are the pharmacological action of adrenergic drug? So previously we'll say about the classification of adrenergic drug. So adrenergic drugoችን ክፍል ክላሲፊኬሽኖችን ካየን በኋላ so what are the pharmacological action of adrenergic drug? So the first one is beta 2 agonist. So beta 2 agonist. So beta 2 agonists are a drug that are important for the treating bronchial asthma. So the beta 2 agonist drug are a drug that are used for to treating a bronchial asthma. So bronchial asthma ያክሙልናል። ሁለተኛ they treating peripheral vascular disease PVD or RD renal disease የሚባለው ሜዲካል ፕሮብሌሞች ያክሙልናል። ሶስተኛ sometimes is a beta 2 agonist drug they are ordered by gynecologist. በጋይናኮሎጂስት ሐኪሞች ሊታዘዝ ይችላል when the women have an history of premature delivery. so ከወሯ በፊት ቀድማ የምትወልድ እናት ካለች ለእንደዚህ አይነት ችግሮች ቤታ 2 አጎኒስቶችን ይታዘዝ። so this beta 2 agonists are they found on the uterus to postpone premature delivery by inhibiting uterine contraction. uterus contract relax እንዳያደርግ በማድረግ ከእርግዝና ወቅቷ በፊት ልትወልድ ችግር ያለባትን እናቶች ሊያክም ይችላል። so they are treating postpone premature delivery. so beta 2 agonists are they are very important. they treating bronchial asthma, peripheral vascular disease or renal disease as well as to postpone premature delivery. So what is an adverse effect when the patient are taking beta 2 agonists? So the first one is exacerbation of hyperglycemia. So they are seriously they follow the patient blood glucose level, especially diabetic patient. So በተለይ የስኳር ታማሚዎች ከሆኑ ቤታ 2 አጎኒስት ድራጎችን ከወሰዱ በኋላ የስኳር መጠናቸውን ስለሚጨምር በተቻለ መጠን ቤታ 2 አጎኒስት ከወሰዱ በኋላ ብለድ ግሉኮዝ ሌቭላቸውን ኮሬክት ኦር ፎሎ ማድረግ ያስፈልጋል። the third one is hypokalemia. so በሰውነታችን ውስጥ ያለውን የፖታሺየም መጠን ሊቀንሱ ይችላል። so strictly are follow with the patient with hypokalemic patient. so hypokalemic patienቶች ካሉ ጥንቃቄ ማድረግ ያስፈልጋል። these are worrying of anything they are affecting the certain. so የተወሰነ ማንኛውም ነገር የሚያስጨንቃቸው ይሆናል። the second one is alpha 1 selective የምንላቸው. so alpha 1 selective are important for treating nasal decongestion. የአፍንጫ መታፈን ላለባቸው ፔሸንቶች እነ ዛይሎሜታዞሊን የምንላቸው ናዛል ድሮፕ አላቸው። so they are treating for nasal decongestion. so alpha 1 are they found on the blood vessels. so they are very phenylephrine are the best drugs they treating hypotension. so በጣም ሲቪርሊ ሃይፖቴንሽን ውስጥ የገቡ ፔሸንቶች ካሉ ያክማል። ሌላ ኮምባይን ዊዝ ሎካል አነስቴዥያ alpha 1 selective phenylephrine is better than adrenal because adrenaline is non-selective. so they are affecting all system because they are selecting a different receptor. when local anesthesia lidocaine combined is when phenylephrine because phenylephrine is selecting only they selecting alpha 1. so alpha 1 they found on the blood. so they are decreasing other side effects. the fourth one is eye redness. We have redness of the eye ካለ alpha 1 selectivዎችን እናዛለን. So what's the adverse effect with the patient after taking alpha 1? Because the treating hypotension to hypertension. ስለዚህ blood pressure ሊጨምሩ ይችላሉ። mydriasis ያመጣል። So difficulty of urination or urinary retention ያመጣል. So then a patient without taking alpha 1 selective drug, they are seriously they follow their blood pressure as well as urine output. So the third one is alpha 1 and alpha 2 agonist. Alpha 1 and alpha 2 agonists are important for nasal decongestion. So they're treating for they have any nasal decongestionዎች ካለ የታፈነ አፍንጫ ካለ eye redness ካለ በስትክክል ያክሙልናል. The third one is hypotension. So alpha 1 and alpha 2 agonists are important for the treating nasal decongestion, eye redness as well as hypotension ያክሙልናል. So what are the major side effects for alpha 1 alpha 2 agonists? They are increasing blood pressure, hypertension. So the fourth one is noradrenaline releasing agonist. Noradrenaline releasing agonist. So these noradrenaline releasing agonists are amphetamine or tyramine የምንላቸው መድኃኒቶች. So they are very important for the treating obesity. ከመጠን በላይ ውፍረት ያላቸው ፔሸንቶች አምፌታሚን as well as tyramine ቢወስዱ እንዴት ነው ውፍረትን የሚያክሙ ስንል አምፌታሚን are the treating obesity by decreasing appetite. የምግብ ፍላጎትን በመቀነስ ውፍረትን ይቀንሱልናል። ሌላው ናክሮሌፕሲ የሚባለውን ሜዲካል ፕሮብሌም ያክሙል። ሶ ናክሮሌፕሲ is a medical disorder that person is characterized by excessive sleeping on the daytime. ሶ በማንኛውም ቦታ ላይ ቁጭ ባሉበት ሰዓት ላይ ለረጅም ሰዓት የሚተኙ ከሆነ we call it narcolepsy or sleeping on the daytime. The third one is when a person with attention deficit disorder ADD አንድ ሰው አቴንሽናቸውን ኮንሰንትሬት አድርገው መቀመጥ የማይችሉ ሰዎች ሜዲካል ፕሮብሌም. ሶ ዚስ ኖራድሬናሊን ሪሊዚንግ አጎኒስት አር ቬሪ ኢምፖርታንት ኢን ትሪቲንግ አቴንሽን ዲፊሲት ዲስኦርደር። ሌላው ኢንክሪዚንግ ለርኒንግ አስ ዌል አስ ሚሞሪ። ሶ አምፎታንሲን አር ቬሪ ኢምፖርታንት ፎር ዘ ኢንክሪዚንግ አወር ለርኒንግ አስ ዌል አስ ሚሞሪ ካፓሲቲ. So what are the side effects of noradrenaline releasing agonist? The first one is hypertension. The second one is tachycardia. The third one is depression. When a person are taking noradrenaline releasing agonist, they developing hallucination. They are immediately stop the drug because hallucination is false perception. So there are two type of hallucination, visual hallucination as well as auditory hallucination. ለሌሎች የማይታይ ለነሱ የሚታይ፣ ለሌሎች የማይሰማ ለነሱ የሚሰማ አድርጎ የሚያሰማቸው ሳይኮቲክ ዲስኦርደር ነው hallucination. So they are very very serious kind of complication for noradrenaline releasing agonist. They are psychosis. So psychosisዎችንም side effect ውስጥ ሊመጣ ይችላል. So the fifth one is a mixing agent. So the mixing agent is ephedrine. So ephedrine የምንለው መድኃኒት ነው። So this ephedrine are important for the treating a chronic asthma. ለረጅም ጊዜ የቆየ አስማቲክ ታማሚዎችን ያክማል። is nasal decongestion ትሪት ያደርግልናል። hypotension ያክምልናል። acting as a mimetic agent, they are used for ophthalmic ፊዚሻን ሶ የአይን ሐኪሞች አይን ምርመራ ከመጀመራቸው በፊት ፒፕል ሳይዝን ዳይሌት ለማድረግ ይጠቀሙበታል። they are treating for ADD attention deficit disorder የሚባለው ነው የሚያክምልናል። ኖክቹራል ኢኑሪሲስ ብዙ ጊዜ ህፃናቶች ላይ የምናየው ችግር ነው። ኖክቹራል ኢኑሪሲስ ማለት ህፃናቶች በሚተኙበት ሰዓት ላይ ሽንት ማምለጥ ነው። አልጋ ላይ ራሳቸው ላይ ሽንታቸውን የሚሸሩ ህፃናቶች ካሉ ኢፌድሪን is the best drug because ትሪጎን ስፒኒክተርን ኮንስትሪክት ያደርግና ብላደር መስሉን ደግሞ ብላደር መስሉ ውስጥ የምናገኘው ዲተሰር ሪላክስ በማድረግ እንቅልፍ በሚወስዳቸው ሰዓት ላይ ሌሊት ላይ ሽንት እንዳያመልጥ የሚያደርግ መድኃኒት ነው። ሶ ኖክቹራል ኢኑሪሲስ የሚያክምና so what are the adverse effects of mixing agent of ephedrine? The first one is hypertension, the second one is tachycardia, the third one is CNS stimulation. So be careful, always they are using adrenergic drug. Adrenergic drug ለፔሸንት ስንሰጥ ሃይፐርቴንሲቭ ፔሸንቶች ከሆኑ ጥንቃቄ ማድረግ ያስፈልጋል። These are all over about adrenergic drug pharmacological use. So please like, share, comment, subscribe.